Good morning. Can you all hear us back there? Great. So I'm Katie Meehan. I'm a health equity consultant with the Center for Public Affairs.
I'm Megan Mickelson. I'm a public affairs consultant. I can't remember. Something like that. Center for Public Affairs.
And we're here to talk about our health equity and all policies, work and related measures. So we had some old, I'm calling them old measures because they're not super relevant today, but a few measures that were in the old strategic plan. They were looking at the percent of training attendees beyond bill analysts that basically attended the pre-session training, percent of bill analysis that indicated any response under health equity or tribal health impact, and the third was the percent of bill analysts that attended the training. I'm going to give you a little bit of our history to explain why those aren't the best measures now and where we're kind of going. So in 2015, the department integrated some health equity and tribal health impact questions onto the bill analysis form. So anyone who's done bill analysis over the last couple of years would have seen those, maybe answered them. After each year that we did this, the health equity work group did an evaluation of the responses. And so in 2016, one of the big things that changed was folks who were answering those questions wanted better kind of guidance or information. So a reference guide was developed. So that's that Health Equity and Tribal Health Reference Guide. And we started to provide opportunities for training. In 2017, we continued those. So a couple members of the work group worked with division policy leads to go and add a little bit of health equity information to the existing pre-session training. And after 2018, and basically last summer, we were lucky to have a CDC fellow who was finishing up her work with us and able to really devote a pretty big chunk of time to do a really comprehensive evaluation. And so she didn't just talk to bill analysts, but she also talked to executive and agency leadership who sit on the agency bill review team to see how, when you get these answers, how are you using them in your decision making? Are they informing conversation at all? How relevant is the training? And basically there was a lot of things that came out of that evaluation, which led us into 2019, which is where we made some pretty big changes. So the big ones are, she found in the evaluations the health equity and tribal impact questions as they were written really weren't very helpful. I don't know if we put those in there, but I'll share those with you. That, even though staff really did start to find the value of answering those questions, and we saw the responses improve over the years and more complete responses as well, we know that staff have a really quick turnaround when they're doing a bill analysis and may have subject matter expertise in what the topic of the bill is, but maybe not in health equity. So looking at what could we do at the agency level to supplement that, not replace it, because we think it's still valuable to have it be part of the conversation in the standard form, but how can we supplement that at the agency level where we have more health equity expertise and also a little bit maybe more time to just focus on that aspect of analysis and not the health subject matter. And then one of the things we found is that even though staff are putting a lot of time into these answers, they felt, and we kind of proved true through the CAMFORM interviews that the CDC fellow was able to do, was that they really weren't informing discussion very much at the agency bill review table. And that's, again, they have a lot to look at and not a lot of time, and not having someone there to be able to speak to those responses or questions that may come up around them at that exact moment kind of inhibited the ability to have those thoughtful answers really brought to conversation. So this year as well, we had Paj Nandi, so our Director of Community Relations and Health Equity, who's our supervisor and also participated in the health equity impact assessments, actually at the table and part of those conversations. So many of the times, the same things that we found in our health equity impact assessments were also found in the divisions, but he was at least able to speak to those and bring up supplemental information into conversation. So this is the health equity impact assessments that we completed. And so, as I mentioned, the standard bill form has two questions. One is around the impact on health equity, and we actually reframed that this last year to really just focus on the communities that would be affected, and that's actually, I'm going to skip ahead, which communities may be affected. So that we're trying to get people to get less caught up in the jargon around health equity and really more think about what communities could be disproportionately impacted, either positively or negatively. If people are able to identify that at the program or office or division levels, we're able to maybe do a little bit more research into that. And often we found that folks that are closer to, the actual work may think of other communities that we won't think of when we're, just thinking of this from a larger policy standpoint. The tribal question that was revised on the health equity, on the bill analysis form was revised to this number 2 that we also kept on our health equity impact assessment. And that's after consultation with Tamara Fulweiler, our DOH Tribal Relations Director. Before, our earlier reiterations really looked at assessing for tribal health impacts and impacts on tribal nations. And what we found from our conversations with her is that that's really outside of the scope of what we should be doing during bill analysis. Because when we talk about potential impacts for our tribal partners and tribal nations, that's something that they should be telling us through a formal consultation and collaboration process. And so basically what we really just want to know is, if this bill were to pass, would it activate the consultation and collaboration procedure? And that provides kind of just an early flag for TAMRA, so that the bills that do pass and they come back to us for rulemaking, that's already at the forefront of our minds as we're going into that next process. So those are the two revisions, the revisions to the questions on the bill review form. As I said, we decided to do something complementary to supplement that at the agency level. So we came up with a 5-question health equity impact assessment. We carried over those 2 questions. So this one here about the tribal activating the tribal consultation and collaboration procedure. And the third one here, looking at what communities may be affected. And then we added just a couple more since we had a little bit more time to do a deeper dive on our end. So looking at the first one, the overall health equity impact, whether it's positive, negative, neutral. Again, the tribal consultation collaboration procedure, what communities may be affected. And so you see in bold on the left-hand side, those are a lot of different factors. So when we talk about social and economic factors, these are some of those that we think of. And then within them, right, there's different communities that could be affected. So we think of age is definitely a factor in our health, but within the factor of age, there's different communities and communities that we consider to maybe be at greater or lesser risk to health disparities. So we're calling out higher risk groups, including like infants, children, youth, and older adults. So when we're looking at a bill from the health equity impact assessment, we're trying to really dive deep into that sub-community level that analysts may or may not have time for in their quick turnarounds. We're also wanting to, we have the open-ended what other communities or external groups might be affected. Not everyone falls under that nice table that we have, but this question 5 is kind of the other big chunk of our assessment and what differs when we do it at the agency level compared to as part of the standard bill analysis process is that we're also looking at the impact that the bill may have on the social determinants of health. So we follow what they have in Healthy People 2020 as the main categories, and that's the 5 that you see here. So for economic stability, we're looking at, is there a way that this bill could impact positively, negatively, or not at all, employment, food insecurity, housing stability, or poverty. For education, we're looking at everything from early childhood education to higher ed. Language and literacy also fall under there in the way Healthy People 2020 structures social determinants of health. We're also looking at the social and community context. So we know things like civic participation, discrimination, incarceration, social cohesion, those all impact health. Health and healthcare, this is where any of our access to care work falls. So a lot of the bills we saw that came through, maybe HSQA was lead on, we're really thinking about access to care in those ones. And then the last, neighborhood and built environment, access to healthy foods, crime, violence, environmental conditions, and quality of housing. And that's where we saw a lot of overlap or potential overlap with some of our EPH bills.
So basically it was Katie, Paj, and I doing this additional assessment beyond the bill analysis that was done. So every Monday we got together. Well, actually we did it every time the bills dropped, right? Twice a week. So we had a phone meeting and we would go through all the bills and do a quick run through them and figure out which one should we prioritize for this health equity impact assessment, because we couldn't analyze all of them, obviously, just the three of us. So we also clued in the division policy leads and asked them to clue us in if there were certain ones that we really needed to do this additional assessment on. And we really looked at what were the potential equity impacts or impacts to social determinants of health. Was there an existing health impact review done by the State Board of Health? Was the bill related to an agency priority or a division priority, or affected multiple areas of the agency? And then also, what was our level of subject matter expertise? And that's kind of how we assigned them based on each of our different experience levels. And then also the capacity, how much capacity did we have to the time that we could do to do this deeper dive? And they really did take a considerable amount of more time than just the traditional bill analysis. First of all, because these were all agency-wide bills, and so we did have to, if we didn't have the subject matter expertise, we did have to do a lot of reading and more thinking about it on a different level than a traditional bill analysis. So what we learned, am I forgetting anything before I go on to that? Okay. So what we learned from this additional pilot is that finding those agency priorities, or sorry, not that part. What we found is that having somebody at bill review, having Paj there speaking to the health equity impact at bill review, heightened the need for health equity across our agency. And it was included in the health equity impact assessments were included in the packets that went to bill review. So even if they didn't get discussed at bill review, it still was in the reading materials that prepped people for bill review. And then we also learned that by having more time and additional questions, we were able to do a deeper dive. And the bill analysis kept the focus on impact to Department of Health, but we had the opportunity to look more at the other communities that might be affected that might not first come to mind with the policy analyst doing the bill analysis. So there were some questions, though, that kind of limited the bill analysis and also our assessment. So one of the questions is, does this have an impact on the Department of Health? That leaves out how this bill could impact our overall mission. It might affect the people that we are trying to work with, but it doesn't necessarily directly impact our programs. So, right? So that's something that we're thinking about for the future is how do we need to change those questions, because it's a broader impact as health equity is one of the focal tenets of our agency. We need to not just be specifically thinking about the programs and the impact of the programs, but what about our greater mission and who we're trying to improve health and safety in lives of.
Yeah, and so this is just, kind of a continuation of what Megan was saying. So we're trying to look at, as an additional potential question or somehow, we know we have to ask about impact on DOH, from a financial perspective, from a programmatic perspective. But what we found is if people check no, it automatically is no longer agency tracked. And there are bills that we would want to maybe support or in some way that, is maybe going to affect one of our sister agencies, or it's going to support increased economic opportunity or employment opportunity or education. It doesn't affect us at DOH, but if that bill were to pass and it is supported by our sister agency, it could actually then impact the health of the people that we're trying to serve. And so how do we leave space for that? Also taking into consideration that we know time is tight during legislative sessions. So also thinking about how can we use the time between sessions to meet, bills that don't pass, but we see have a really great potential around impacting the social determinants of health outside of our scope. how can we support those maybe, or work with our sister agencies or other representatives to strengthen those. This, we're just, you know, I hope a lot of people have seen this, are probably familiar with it, but when we think about what actually impacts health, you know, traditionally in public health, we used to always think it was our personal health behaviors and choices, and all that definitely plays a role, but basically all roads lead back to that. So we know that, you know, if our, we might be looking at things around, bills around vaping or things like that, and we care about those deeply as the Department of Health, but we do know that, you know, our social and economic position greatly affects, you know, our risk of vaping, or our environment, or access to healthcare. All of those things lead back. So just wanting to look at how can we, when we're doing our health equity impact assessments, keep that broad lens and think about how we can think about our policy agenda that way as well.
So as we go to create new measures, as we're adapting our measures from what they were to what they should fit into the new strategic plan for, we're looking at and evaluating this pilot. And to do that, we are going to compare the responses from the bill analyses to those two questions, and also compare them to the health equity impact assessment and see if they align, or maybe they are different. We also are going to look at the health impact assessment and how it affected the agency position, or if there was some discussion around it at bill review. And then we want to meet with leadership to understand if this additional assessment was of value for bill review and during session. And then we also need to think about our capacity to formalize this process within C4PA. All right. Couple more things. So we are going to be developing recommendations for next session, and we also want to take the impact assessments that were done, and for those bills that did pass, and if there is rulemaking associated with those bills, make sure that that gets incorporated, or at least the rulemakers are informed of the additional assessment that was done. And then again, incorporating this work into the current strategic planning efforts. So I'd love some audience participation. How many of you participated in the bill review process, and does anyone want to share how that went, especially these two health equity questions? Anybody online? No. Come on, I know some of you guys are thinking about speaking up. No one? Okay, well.
This is Kathy Lofi. Can you hear me?
Yes.
Oh, okay. I was going to say, I thought that the pilot was a success. I thought that this past session, health equity was much more at the forefront during our bill reviews than it had been previously when we just had the question. So I thought that the process you guys worked, or you used, worked pretty well.
Thanks, Kathy. So I'll just skip to the next question, and if there are any recommendations for improving our process, if anybody connected with us during session. No, silence. Okay. And then as we move forward, does anyone have any suggested measures that we should be using? Remember, our previous measures were related to training and how many bill analysis actually answered those questions. So what kind of measures should we be looking at? Yes, thank you.
Microphone.
All right. The default measure for just about anything like this you may want to think about is how long does it take to actually go through your evaluation stuff. Because I know timeliness is an issue, and being able to get them responded to in a certain timeline. So that's where I'd start, maybe, is how long does it take?
Yeah, I think that's actually a pretty good measure. And some of the bills are 2 pages and some of the bills are 15 pages. So that's one of the hard things with time in this, but I think we should definitely be looking at how many we could do per week based on the number of staff that we have working on them. So thank you. Oh yeah. Oh, we forgot to tell you that we did 24 overall health equity impact assessments. And this is something that is not actually in our position description. So this is like time on top of our other work duties. So.
So it looks like Joby was asked or pointing out that, or asking, when presentations were made to the legislature, was health equity used for info and or to influence the vote?
That's something I think we need to add to our evaluation too, because, I mean,
we were able to incorporate some of the content from our health equity impact assessments into some of the correspondence and testimony that John gave. So in those situations, and that's kind of where we benefit from Megan's connection of also doing executive communications. But in terms of like, I think we need to work on something a little bit more systematic where, you know, whenever we're doing correspondence that we're looking, is there something else we can pull from? So we were able to use it a little bit, but yeah, still need to work out. You know, this was a very, very rough pilot. We had no idea like what we would be able to do or how it would go. And so I think we learned a lot, and we'll be able to iron out those processes so they're more consistent for next year.
So this is Judy, and we're happy to sit down and talk with you about measures if you'd like. But sort of 3 big questions that can be helpful is how many of the thing did you do, how well did you do it, and what difference did it make, right? And so just kind of thinking along those lines as you're developing metrics might be really helpful. But we're happy to sit down with you.
Yeah, and that's why, you know, we would really like to move more towards some impact measures. You know, for many years now, we've been tracking process measures, which aren't bad, but in terms of, you know, how many people attend training or how many questions were answered, that doesn't actually tell us, did this make a difference, which is what you're getting at. So we really want to see how does this inform conversation and potentially, you know, actually inform our position on something, those are bigger conversations we still need to have.
All right, thank you, everybody.